Healthcare reform. Tennessee Republican Marsha Blackburn, member of the House Energy and Commerce Committees, which oversees healthcare, and senior Democratic whip John Yarmuth, the Kentucky congressman who sits on the House Ways and Means Committee. Yarmuth supports the healthcare bill announced in the House yesterday. Welcome to you both. Congressman Yarmuth, let me go to you first. What are the biggest problems that some people have with the bills as they've seen them so far is that they have no idea how they're going to get paid for, and they're afraid that the main way would be by taxing them more.
Well, actually, no, we know how we're proposing to pay for the cost of this program, and we're paying for it by demonstrating a significant number of cuts in Medicare spending. We think there's a lot of waste and fraud that appears there that we can cut out. We can change practice patterns. We've set up the mechanism in the bill to do that and hold down costs and change the trajectory of costs in health care. And finally, we're going to propose to levy a surcharge on the wealthiest Americans, 1% of Americans who have benefited unreasonably under the Bush tax cuts and now can afford to help pay for providing stability and peace of mind for every American where their health care is concerned.
Well, you know, the folks in that bracket are going to listen to that and say, boy, you know, they're getting hit pretty much every which way in their corporations, in their small businesses, and now they get to pay for health care, too.
And this is the best thing that's happened to small business in the history of this country, because what it does finally is set up a system whereby small business owners can find affordable health care for their employees if they want to pay for it. And if they can't afford to do it, it sets up a mechanism so those employees can find affordable health care, which they can't do now as individuals, and continue to work for those companies.
Let me get to Representative Marsha Blackburn. Marsha, let's just go right to where this conversation is right now. A lot of people think that what will happen in small businesses is that they won't end up having to offer it at all because there's going to be a public option on the table, and you know they'll push back and not offer their employees anything and have the government pick it up.
You're right, Martha. The test case for public option health care was my state of Tennessee. And what we have found out is that a public option plan is too expensive to afford. And certainly, as the president says, oh my goodness, we can't afford not to fix this. What we know is that the United States of America cannot afford to repeat the mistakes that we have seen played out in the TennCare delivery system. Now, my colleague says this is the best thing ever for small business. I would offer as an opposition to that this is probably one of the worst things that has happened to small business. And when he talks about taking money out of Medicare savings to our seniors, I would say, look at what they're going to do. The money you've been setting aside all your working career to pay for Medicare when you retire, they're going to take that money to offset the price of government-run health care, and then you're no longer going to have Medicare. What you're going to end up seeing is you're put into the system that they're offering. And I think that is really unfair to our seniors.
So, you know, there is a feeling, a sort of creeping along feeling that more and more Americans, and we're seeing it arise in some polls, Congressman Yarmuth, are not happy with this. They're very concerned about this plan. They don't want the public option, and they don't feel like this is, you know, the right way to go. How are you going to speak to your constituents when you go back home who feel that way?
Well, first of all, most of the polls have showed that up to 75% of the people approve of the public option. They want that choice. They want to be able to have a public plan competing with private insurers for their business. That would be great. That's the American way, competition. So I don't think we have a big sales job to do on that. Actually, the CBO just projected that only 3% of the American people would choose the public option. That's as of 2019. So all this talk of this is a government takeover, big government, isn't borne out by the facts.
All right, let's give Marsha the final thought. Go ahead, Marsha, on the final thought there.
Yes, you know, what he is saying, I beg to differ with. There is a test case for public option health care. It is the TennCare program in the state of Tennessee. What we have seen is it was too expensive to afford, and the burden fell on the state. It used up every new revenue dollar generated in the state. It consumed 36% of the state's budget. What we saw was 55% of the enrollees into that program were individuals who had previously had private option insurance because they knew they could come into this free public option, and it was a gold-plated program. And Martha, it is something that the taxpayers of this nation can't afford any more than the taxpayers of my state. They've spent a decade digging out.
All right, Congresswoman Marsha Blackburn and
oranges.
Congressman Yarmuth, I would urge both of you to continue to listen to what the constituents and the people of this country are saying out there. I'm hearing it everywhere I go. People are, concerned about what they're getting here, and especially about the increase it's going to mean in their taxes. So we will see. Very, very important issue, and we thank both of you very much for being here today.